Your golden retriever is outside, doing what goldens love most, running through the yard, sniffing the grass, chasing anything that moves. Then suddenly, a sharp yelp. They start pawing at their mouth. Drool begins pouring out. And within minutes, something feels very wrong. Most owners assume it's minor. Maybe a bee sting, maybe a bug bite, maybe it'll pass. But emergency veterinarians across the United States warn that when a golden retriever swallows a bee or wasp, the real danger may already be developing where you cannot see it. Inside the throat, inside the airway. And if swelling begins there, the situation can become dangerous frighteningly fast. What makes golden retrievers especially vulnerable is their personality. They are playful, curious, excitable. They snap at insects constantly. And because goldens usually tolerate discomfort well, many owners don't realize how serious the situation is until symptoms suddenly escalate. That delay can become dangerous because in some cases, minutes matter.
Here's what experienced vets say surprises dog owners the most. The first symptoms often don't look dramatic. Your golden retriever may simply seem uncomfortable at first. Lip licking, heavy drooling, repeated swallowing, pawing at the face, restlessness. But then, the swelling starts. Sometimes around the lips, sometimes around the muzzle. And the most dangerous swelling of all? The swelling you cannot see, inside the mouth and throat. That's why breathing changes are one of the biggest warning signs vets watch for immediately. Not always choking. Sometimes it starts subtly. Heavier panting, noisy breathing, a raspy sound, a strange cough, a bark that suddenly sounds different. Many owners wait too long because the dog is still walking around, still wagging their tail, still trying to act normal. But golden retrievers are incredibly resilient dogs. They often continue functioning even while serious swelling is developing. And then suddenly, they crash. That's why vets say if your golden retriever's breathing changes at all after a bee or wasp incident, you should never ignore it.
Most people think bee stings and wasp stings are basically the same. They're not. Bees usually sting once. Wasps can sting multiple times. And golden retrievers often make the situation worse without realizing it. A golden sees a flying insect, snaps at it, gets stung, then tries to bite it again. Some dogs receive multiple stings inside the mouth within seconds. That dramatically increases swelling and irritation. And because the inside of the mouth contains sensitive tissue, reactions there can become severe much faster than stings on the paw or skin. Another problem? Owners often don't actually witness the sting. They only notice symptoms afterward. The dog suddenly starts drooling, or gagging, or pawing frantically at the mouth. By then, swelling may already be increasing. This is exactly why emergency vets say never to wait and see if symptoms are worsening, especially in large, active breeds like golden retrievers.
The first thing is simple. Stay calm. Your golden retriever reads your emotions instantly. If you panic, they become more stressed, and stress can make breathing problems worse. Bring your dog indoors immediately or into a cool, quiet area. Now, carefully check the mouth if your dog allows it safely. Sometimes a stinger may still be visible. If you can remove it gently and easily, do so carefully. But never waste valuable time fighting your dog or digging deep into the throat. That's a mistake emergency vets warn about constantly. Your focus should be monitoring swelling and breathing. You can apply a cool compress around the muzzle to reduce discomfort externally. And yes, many owners ask about honey. Honey may slightly soothe irritation, but this is critical to understand. Honey does not stop allergic reactions. It does not reduce dangerous airway swelling, and it should never delay emergency veterinary care. If swelling increases, if breathing changes, if vomiting starts, or if your golden retriever becomes weak or disoriented, you need veterinary help immediately.
The biggest mistake isn't panic, it's hesitation. Owners wait because the dog still seems okay, but airway emergencies don't always look dramatic in the beginning. Some dogs decline gradually over 10 to 30 minutes. Others worsen almost instantly. And unfortunately, many owners underestimate how quickly throat swelling can block airflow, especially during hot weather or after physical activity. Emergency veterinarians say they repeatedly hear the same sentence from frightened owners. "He looked fine at first." That's what makes these situations so dangerous. By the time severe breathing distress becomes obvious, oxygen levels may already be dropping. And here's something many golden retriever owners don't realize. Large dogs can hide symptoms surprisingly well. Your dog may continue standing, walking, or responding to you even while struggling internally. That's why subtle breathing changes matter so much.
If your golden retriever shows any of these symptoms after a bee or wasp incident, vets consider it an emergency. Difficulty breathing, tongue swelling, pale gums, weakness, vomiting, collapse, extreme drooling, disorientation, repeated gagging, blue or gray gums. These signs can indicate a severe allergic reaction known as anaphylaxis, and anaphylaxis can become life-threatening very quickly. Some dogs may also experience delayed reactions hours later. That's why vets often recommend close monitoring, even if symptoms initially improve. Never assume the danger has completely passed too early, especially after mouth or throat stings.
Golden retrievers are among the most beloved family dogs in America for a reason. They're gentle, happy, loyal, playful. But that playful personality is exactly what gets many Goldens into trouble with bees and wasps. They'll investigate everything. They chase moving objects, and they often try to catch insects directly with their mouths. Many owners think, "My dog would never do that," until one day they suddenly hear that painful yelp outside. And here's the truth. Most sting incidents end up being mild, but the dangerous ones escalate incredibly fast. That's why experienced dog owners and veterinarians treat mouth stings very differently from ordinary skin stings, because the airway is involved. And once swelling begins there, time matters.
If your golden retriever ever swallows a bee or wasp, don't focus only on the sting itself. Focus on the breathing. That's the real danger. Watch your dog closely. Listen carefully. Notice even small changes. Because the owners who react fastest are usually the ones whose dogs recover best. Not because they overreacted, because they recognized the warning signs before the situation became critical. Golden retrievers trust us completely. And in emergencies like this, staying calm, acting quickly, and taking symptoms seriously can make all the difference. Sometimes, those first few minutes are everything.